Like the ever-changing ocean, so is the female brain. Estrogen and other ovarian hormones affect brain structure, chemistry, and function across the female lifespan, shaping behavior, mental health, modulating brain structure, chemistry, and function. So, it's not surprising to find that as hormones wane, women experience brain changes that can alter how they see their world. In archetypal psychology, the crone, a term that comes from the word crown, means to honor what is of the mind. As women transition during the menopause, the head, heart, and soul unite to provide an aerial viewpoint of life, seeing and calling things for what they are. A heightened sense of intuition and seeing into our own beings called interoception develops. However, this process can be interrupted related to past or current trauma, the making of a bad partnership, or the numbing effects of certain medications that may be prescribed to treat anxiety, depression, and pain. It's never too late, though, to recover mental, spiritual, and physical health using thoughtful approaches of psychotherapy and integrative medicine. What has been suppressed may need to be addressed. Cannabis may have a role, along with psychotherapy and careful drug tapering, to help women enter the wise womanhood that they are destined for.
Prior to going to naturopathic medical school, my entrance into healthcare was as a midwife. I trained in the state of Texas as a direct entry midwife, so that means I didn't go to nursing school. I trained directly by learning how to take care of women in pregnancy. I cared for pregnant women, their families, and women beyond pregnancy as a midwife in Texas for 10 years before going to naturopathic medical school. So I've had a keen interest in women's health across the lifespan since about 1990. In 2010, I was in Washington State when naturopathic doctors were added as care providers who could recommend cannabis and authorize its use. And that was my clinical entry into using cannabis as a medicine. And so that's my background and why I have an interest in this topic and imparting to you the things that I've learned over the years. I've been a member in the International Cannabinoid Research Society since 2005. I've been a member of the International Association of Cannabinoid Medicine since 2008. So I've been involved in larger dialogues about cannabinoid pharmacology and cannabis use internationally for quite a while. I'm very interested in this botanical medicine that has powerful effects on the human body. I was also formerly a board member on the Society of Cannabis Clinicians. This is an organization for clinicians who are wanting to learn more and focus on the endocannabinoid system function in health and disease. I'm currently assistant adjunct faculty in the Department of Anesthesia at the University of California, San Diego. My role there has been to bring cannabinoid medicine into the medical training, the training of residents and fellows, and working with patients within that system to use cannabis for tapering off of opioids, helping with their sleep, autoimmune disorders, neurologic diseases, and cancer. So let's dive in and talk about the endocannabinoid system in this time of life. This change of life can be associated with insomnia, anxiety, weight gain, weight loss, cognitive changes, bone loss, changes in skin. And these can really affect our self-esteem as older women. This is why the change of life can be a difficult transition. As estrogen's declining, we really have to be more proactive in our health to take up the slack. There's many changes that are occurring that limit the things that we can do that we used to be able to do when we were younger, how we feel, how we feel after exercising, what kind of exercise we can do. And we're going to be discussing all of this and the role of the endocannabinoid system. In general, many people may think of this as aging or a degenerative process, something negative associated with illness or becoming decrepit, useless in society. But none of these things have to occur. Even prior to perimenopause, women suffer more commonly from anxiety, depression, post-traumatic experiences. And estrogen, as we've said, can influence the response and can be sometimes behind this occurring. Things that also contribute to mental health problems are poor diet, inflammation, poor sleep. So there are a lot of things that we can do to proactively address mental health issues. Unfortunately, what happens often is women seeing conventional doctors are put onto antidepressant medications, anti-anxiety medications. Now there's ads on TV for your antidepressant's not working. Well, let's add another one onto it. And I'm starting to see many women in older life who don't want to be on these drugs anymore. And they're wondering, can I get off of these drugs? What happens if I discontinue them? Am I going to go back into that deep depression? Honestly, my life experience is that we go through periods of being happier, being sadder. We go through tremendous life changes. We have things happen out of our control that can all affect our mental health. And there may be a role for these drugs at certain times in people's lives. But staying on them for the course of your life is probably not necessary, because sometimes the things that we were going through at the time we were put on a drug like that have passed. We've resolved that. The other thing that could happen is that being on those drugs may actually suppress our ability to fully experience what was happening. So I've had some really good success using cannabis along with other herbs and nutritional supplements to help wean older women off of drugs such as Klonopin. This is a benzodiazepine drug. The most recent information coming out about the benzodiazepines, whether used for anxiety or often used for sleep, is that they may be promoting dementia in older patients. So if you're on any of these drugs and you're interested in getting off, there is hope that you can do this. You should do it with a healthcare provider who has been involved in this before, who has strategies for helping you taper the drugs, treat the withdrawal side effects, and get you through until you are the new you, maybe the you who's been covered up by these drugs for many years.